Hello, my name is Dr. Lonnie Herman, and if you or somebody you know or love, somebody in your family has Down syndrome, I think you'll be very excited to hear what Mrs. Rutherford has to say about her son, beautiful Jesse.
Yeah.
And let's talk about what's going on with him. There is another video that I'll show you right here on the side of the screen. There's the first video when he was only about 3 months old, maybe 4 months old, when we first started working together. And he's doing incredible with the work that I'm offering them. And so we want to just give an update on that. I'm going to make another part of this video where I talk about the exam findings of what kind of different infections and chemicals in his brain that we've targeted. And that will help you understand what it's taken to make such a dramatic difference for him. So, Mrs. Rutherford.
Yes. So
now
this is.
I'm sorry. Now he's 10.
Yes,
months
10 months.
old.
Yeah, almost 11 months. We'll see how happy he'll be.
And his doctor. I'm sorry to interrupt.
No, you're fine.
Talk, so thank you. But his doctor, and we see him standing up here and holding his head up by himself, but his primary care doctor, his general practitioner, what in the last visit was how long ago? How old was he?
2 days ago.
2 days ago,
Yeah.
in his 10th month.
Mm-hmm.
And when she examined him, what does she say about his development?
Yeah, she said he's doing great. He has met all of the typical milestones within the right amount of time. And he is understanding a lot and using his words. He's a little on the skinny side, but other than that, no complaints.
So she thinks normal development. Hi.
Yeah, absolutely normal development.
Reflex development, normal function. He's speaking a lot, you said?
Yes, yeah, he's saying mama, dada, nana, mada for his Aunt Madison, night-night. I know you're saying all kinds of things. All done, that's the favorite. But yeah, his pediatrician said at 10 months he is saying as many words as she would expect from a typical child between 15 and 18 months.
Typical child meaning a person who has no Down syndrome.
Yeah, no Down
So
syndrome.
he's very advanced. At 10 months old, he's doing what somebody at 15 months old would
Right,
do.
yeah, with speech, yeah.
That's great. And his eczema was another problem that you came in with, which
Yeah.
I'll show a picture. It's in another video, but I'll put that up in this video as well. And now you see what with his skin.
Almost no problem at all. Occasionally he might get a tiny little spot in the back of his knees or on his foot, but otherwise nothing, which is incredible because he was like covered in it before. Yeah.
And hi. Look at that.
He's just real excited.
Wave into the camera. You're the model.
Hi.
You're the man. High five.
You give a five?
High five.
Give a
Give me
five.
five.
Give a five. Oh, you're clapping your hands.
Not yet. Okay. So, and you've also now referred in a couple of people. You've been around with Down syndrome because your sister
Yes.
has Down syndrome. So you know
Correct.
about this for a
Right.
couple of decades already.
Yeah.
And you work with children who have Down syndrome and,
Right.
and young adults who have Down syndrome.
Yes.
So you've already referred in a couple of people in here who have Down syndrome. What are their families saying about what's happening for them with this work that I'm offering them?
Yeah, so with Down syndrome, as they age, a lot of times you see like regressions and behaviors and things. And some of my clients that are older, like late 20s, 30s, their parents are saying like they're back to their old selves. You know, they're happy again, they have good moods, their behavior is much better, they're able to stay focused. Yeah, they've been very pleased with the differences that they've seen.
Anything you want to tell anybody besides what you've been gracious enough to share?
Well, I would definitely say if you're considering it, go for it. This is definitely the best decision that we made bringing him here. As you can see, he's very mobile and getting everything he wants taken care of. So yeah, I could not be happier with the progress we've seen, and I'm just excited to see how he continues to progress.
Thank you. Me too.
Yes, thank you.
We're very happy where he's going with this. So you're going to stay tuned for another part of this video. I'm going to merge with this video about what my findings are, help you understand more about the brain and brain development, and what I can help you do for your family member or loved one who has Down syndrome, and help you or them develop even better than what you've ever expected before. So stay tuned, and I'll see you on the other side. Well, isn't that just incredible? Isn't that great what Jesse's mother has to say? He's doing phenomenal. He can stand up now. With her help, he can stand up. He can hold his head up. He's doing some crawling. He's saying some words. He's very advanced. He's doing very well. So we're really happy. So I'll tell you one thing that I found with Jesse is that he was having a reaction, and still has a reaction, to his mother's breast milk. Unfortunately, even though it's good to breastfeed and good for the immune system, perhaps, unfortunately, some toxins in the mother can come through the breast milk and actually cause problems in the baby. And that's what I found. So I will just name some highlights of findings that have helped create a better development for Jesse, as well as reading. He's got maybe a tiny percentage of the eczema left on top of one foot and behind one of his legs, but very small amount. No longer does it cover his body. His eye shape has changed. I'll show you that in the video here as well. Right now, you're going to see pictures before and after his first protocol. His eye shape changed. He's a beautiful baby. He's saying words now. I can't repeat enough. It's amazing how quickly he's developing. I did find in his lymphatic system back in June of 2020, he had various viruses like influenza virus, the influenza A virus, the adenovirus, he had Epstein-Barr virus. He even in his lymph system had some xylocaine, the epidural chemical, which I believe the epidural chemical can go from the mother's body through the umbilical cord into the baby's brain. So that's what we found. Moving along, I found also in his follow-up visit in September of 2020, he had the xylocaine epidural chemical in the diencephalon of his brain, a developmental area of the brain, by the way, which comes from embryo development, the diencephalon. He also had the xylocaine in the frontal lobe of his brain, which is personality, speech development, part of memory function, cognitive function. And I also found in that exam that his large intestine and his small intestine, he also had toxic levels of the epidural chemical in there as well. In November of 2020, between November and when he came back in, when his mother brought him back in just recently in this February of 2021 visit, where he's doing incredibly well, I also found with him the xylocaine was in the cortex of his brain, the xylocaine epidural chemical was in his kidneys. I found the xylocaine in the prefrontal cortex of his brain. I found lead in his kidneys. I found xylocaine epidural chemical in the large intestine lymphatic tissue. I found fungal infection and viral infection in certain arteries of his brain that brings blood to parts of his brain. So if those blood vessels are infected, the blood is infected. The parts of the brain that those blood vessels carry blood to, the parts of the brain get infected, and that can impair brain function and brain development. I also found viral infections in his mesenchymal stem cells. These are the embryonic stem cells. I found the xylocaine, the epidural chemical, in the glial cells. These are the cells that protect, repair, and reproduce central nervous system tissues and peripheral nerve tissues. I found some parasitic infection and candida infection affecting his skin. Dramatic improvement between November and February. Again, he's speaking words. He can stand up with her assistance. He's holding his head up. He crawls. He's got a personality. He's a beautiful baby. Different eye shape. Barely any more eczema. And in this exam, I found that certain food that he started eating some solid food, which they make him a rice flour and pumpkin pancake. Well, I found that stressing him. And it was stressing him because he's got some mold in arteries in his brain. He's got various pesticides, weed killer, and herbicide chemicals. I'm going to show you a link to another video that I did where I called it Pesticides Causing Parkinson's Disease, and it's very clear in that video that there's damage to nerve tissues that happen within 4 days of herbicide chemicals put onto the nerve tissue. I explained in a bit more detail in that video, which you can go look at that video. These pesticides, herbicides, and weed killer can damage nerve tissue in the brain and anywhere in the body. So I found those chemicals in his brain. I found Candida albicans and Candida tropicalis in arteries that bring blood to different parts of the brain. I also found food preservative chemicals like BHT, MSG, EDTA in areas of his brain as well. MSG was also in his lymphatic system, and I believe there's also still fungal infection in the brain, as well as MSG in his liver. So we're going to be able to report to you when Jesse comes back for his next exam, which will be, and he comes back in about almost 3 months after his now February 12th visit. So I should see him again about May or June, and we'll report more development. I only expect him to get better and better with this work. I'll report more about my work on my website. I'll put the link here on the screen. It's my name, www.drlonnieherman.com. Go to my website, spend some time looking around. It's very exciting. The work that I do is very unique. The changes that I'm helping people achieve in their body is real. It's possible. If you have or know somebody who has a family member with Down syndrome, share this video with them. Look at this video again. Look at the other videos that I have up. It's not just with Jesse. I have other patients coming in who are singing praise about the improvement that they're experiencing. How far we can go with that brain in a Down syndrome, we'll see. But development is happening. Positive changes are happening. I have another patient with Down syndrome. She's an adult. She's about 19 or 20 years old, I believe. No more OCD. No more, let's call it a split personality, is not happening. We're going to hear from her parents as well when they come back into my clinic for the follow-up with her and their family. So I believe that with my knowledge in neurology and neurochemistry and immunology and endocrinology and various other fields in healthcare, and a very unique system that I process that I do, my method in my clinic, I can help you really help your family or friend achieve incredible results. The time is now. We're ready to help you. I look forward to seeing you. The number to my clinic, 954-370-3100. I'll put the email address here as well. You can call, you can email, you can make your appointment, whether through my assistant, who's very happy to help you, or you can go right on the website. Again, drlonnieherman.com, and you can book your appointment there. There is a specific Down syndrome page on my website. I'll put that link below here on this video, and I really look forward to helping you as well. See you soon.